common question that patients ask me, does alcohol increase blood glucose or decrease it or both? And the surprising answer is alcohol can do both. And that's exactly why it can be dangerous for people with diabetes. So what happens when you drink alcohol? Your liver has many jobs, and one of them is releasing glucose into the bloodstream between the meals and overnight when you're fasting. But when alcohol enters into the body, the liver gets distracted and its priority becomes breaking down that alcohol. So what is the result? The glucose production from the liver decreases. So if you're taking insulin or certain medications like glimepiride, gliclazide, alcohol can actually increase the risk of low blood glucose levels. This is especially important overnight while you're sleeping and up to several hours after drinking, even the next day in the morning. Now, there is a common myth that alcohol contains calories, so it cannot cause a low blood glucose level. But the fact actually is that alcohol does contain calories, but it can still cause hypoglycemia because it suppresses the liver's ability to release glucose. Now, another myth is that I will feel low blood sugar levels if it happens. But the fact is that the symptoms of hypoglycemia that are normally perceived can actually be mimicked by alcohol intoxication. So you can have dizziness, drowsiness, confusion, slurred speech, which means that the low sugar may be actually missed completely. Now, coming to whether alcohol can actually raise the blood glucose level. Yes. So many alcoholic drinks contain sugar, soft drinks, mixers, syrups, and other forms of carbohydrates. Now, this can actually raise the blood glucose level. And then later, after several hours, the blood glucose levels may actually fall. This is why alcohol can cause a glucose roller coaster. Now, the biggest mistake that a lot of patients do is to skip dinner and say, I'll just have drinks, or skip the medication and just have drinks. Now, this is one of the fastest ways to increase the risk of severe hypoglycemia. So what do the guidelines suggest? Now, the safest amount of alcohol for health is none. But if you choose to drink, never drink on an empty stomach. Eat food containing carbohydrates, monitor your blood glucose levels, stay hydrated, and be cautious, especially if you're using insulin and sulfonylureas. Now, while people fear high sugars after alcohol, endocrinologists actually fear the low sugars that can happen at 3 a.m. Thank you.